days ago, there was a wonderful interview, it was about 18 minutes long, on Medscape between the FDA commissioner and the U.S. Surgeon General. And both Dr. Gottlieb and Dr. Adams discussed the important benefits and the harmful uses of e-cigarettes and vaporizers. So what most people don't realize is that there is a difference between e-cigarettes and vaporizers and other products on the market like Juul, which is actually a vaporizer. So for physicians, I want to break down what the difference between the two are. E-cigarettes tend to look more like an electronic cigarette that is non-reusable, where a cartridge is filled with nicotine and any of the other associated flavoring effects that is then heated up by a coil for the patient to inhale. Now, compare that to a vaporizer, which is reusable, which is more of a liquid form, and those think that it's really interesting for that they could add flavors to the actual cartridge and reuse them, recharge them, and it's something that looks slightly different than a regular electronic cigarette. So you may be asking yourself, how are these harmful? Well, last year the FDA and the U.S. Surgeon General declared e-cigarettes to be a national epidemic. Now, I want to break down and discuss the differences between the benefits and harms. So for the benefits, let's talk about adults. So for adults, there's a good study done last year that came out that showed that patients who maybe were longtime smokers who then use regular electronic cigarettes instead as a method to get off regular cigarettes found that e-cigarettes had twice the efficacy than regular traditional replacement therapies for nicotine addiction. So these is such a great way to provide this as a tool or as a resource to someone who is chronically addicted to cigarettes and wants to get down to something that may be a little safer. So exactly, I think one of the readers down there below said, why are there studies showing vaping is good for smoking cessation? And it's because when you compare traditional treatments versus vaping, you see that there is twice the efficacy. So after a 1-year follow-up, the number of people that are continuing to remain from smoking using e-cigarettes had 2 times as many people that had good outcomes as opposed to those using traditional nicotine patches or gums or other methods to stop smoking. So now I want to cover kind of the harms of vaping and electronic cigarettes. And this brings us to teens. So most of the chemicals and compounds found in electronic cigarettes and vaporizers have not been studied. And specifically I want to talk about vaping because while for most teens there is a stigma against smoking or having an electronic cigarette, there isn't that stigma with vaporizers, or the most common one that most people know about is Juul, which by meaning almost all Juul products actually have nicotine in them. And one of the issues with teens is that there's a recent study that showed that in 2018, 21% of all teens had tried vaporizing or e-cigarettes, and that is actually was done out of individuals who are in the 12th grade. And you may be thinking to yourself, you know, that isn't that much, but 21% is double the amount from 2017. And that doubling in the rate of increase is actually why the Surgeon General Adams put this as an epidemic across youth populations. And so while most of those products actually nowadays, especially with Juul, have containing nicotine, that proposes a direct harm to individuals and to teens because nicotine has a direct effect on the developing brain. Specifically, it affects memory, cognition, and performance later in life, affecting the prefrontal cortex, which powers the executive functions and cognitive functions later in life during the developing area. Prefrontal cortex is actually one of the later parts to develop in all individuals. So one of the other things that we need to remember about vaporizers is that about 1/3 of teens that are using these products admit that 1/3 of them have tried vaporizers that have marijuana or THC in them. And the long-term studies from a developing age on marijuana and THC have not been done. So we don't know how those are going to have long-term consequences on any of the teens using these products from a young age.